Many of our college campuses are making the decision to cancel classes or move to online classes. We understand this difficult decision, and we believe it's a decision best made in and by the communities most directly impacted. Earlier this week, we asked Tennessee insurers to consider waiving out-of-pocket costs for those seeking COVID-19 testing. We're encouraged by the response and commend the 8 health insurance companies who operate here that have all agreed to do so. As we continue to learn more, our response will continue to evolve. I encourage everyone to stay vigilant in reading and sharing information from reliable sources. Continue to practice good hygiene by washing your hands often. If soap and water are not readily available, use a hand sanitizer. Cover your cough. Avoid touching your face. Avoid close contact with people who are sick. Stay home if you are sick. If you believe you've been exposed to COVID-19, contact your doctor. Put distance between yourself and other people. These are simple things, but they can make a big difference. We can slow down the spread of COVID-19, and it's critical that we take steps to do so. Stopping it from spreading quickly will ensure that our healthcare system can effectively manage the cases that present themselves in our state. As I conclude my remarks today, I want to make note to many of you in this room who've been working around the clock since last Tuesday to cover developments and to provide the public with critical information. I commend your efforts, and I look forward to continuing to work together to provide information accurately and quickly. Now, let me turn it over to Dr. Piercy for further remarks.
Thank you, Governor Lee. I first want to echo the governor's comments about those of you who are dedicated to providing up-to-the-minute coverage of this rapidly evolving situation. As we continue to ramp up our mitigation efforts, communication with the general public is critical. In the week since we first announced our first case, I want to highlight some of the notable changes. First, we've had expanded case reporting on our website to include county-level data. There is a delicate balance between transparency and patient privacy, and although outside of our standard protocol, we want communities to be able to respond to this unique and evolving situation. We have also had emergence of private laboratory testing through commercial tests. While this is still early, we first received results from commercial laboratories yesterday. The state lab also continues to receive additional testing supplies and will continue to provide testing in addition to those commercial labs. As of this morning, we have enough supplies to test at least 500 individuals in the state lab, in addition to what's being done in private labs. We've issued continued guidance on school closures, mass gatherings, and travel. And I encourage you to pay attention to this, especially as families consider upcoming spring break plans. As we start to see more institutions and event planners make changes, please note that these actions are in an effort to flatten the curve. That's a phrase that you'll likely hear more about, and that deals with slowing the number of cases in order to reduce the strain on our hospitals, healthcare resources, and allow our communities more time to prepare. We've been ramping up our efforts for vulnerable populations, especially the elderly and those in nursing homes. We have had multiple interactions with all of these facilities statewide, encouraging limitation of visitation and ensuring appropriate infection control procedures are in place. Finally, our hospitals have also made significant strides in the last several days on their testing and response efforts. With us today is Dr. Wendy Long, President and CEO of the Tennessee Hospital Association, as well as member of the Governor's COVID-19 Task Force. I will now ask her to give us an update on Tennessee hospital preparedness. Thank you.
Good morning. Tennessee Hospital, as you might imagine, very closely with state and local public health officials to prepare for and respond to the surge in patients that we anticipate as a result of the COVID-19 epidemic. Hospitals have already begun implementing visitation policies and visitation screening processes. Hospitals are beginning to open alternative sites for screening and testing of non-urgent patients in order to assure that emergency departments continue to be available to treat true emergencies. Hospitals throughout the state are coordinating with other hospitals and with other healthcare providers within geographic locations to try to maximize access to needed resources to respond to this epidemic. And hospitals are preparing to implement strategies to increase available bed capacity as that need arises.
Don't visit no hospital.
We are concerned regarding the potential for supply, equipment, and manpower shortages down the road. That will depend very much on the scale and duration of the outbreak in Tennessee. We'll be monitoring all of those issues very closely, but we believe that Governor Lee's declaration of an emergency today will go a long way to providing us with additional options and opportunities to address those concerns. Thank you.
What are you talking about?
So that concludes our
You can go
presentation.
wherever
We
you
will
please. It's just
answer
saying,
questions,
be cautious.
and
I mean,
let me just
hands.
close
See, if you have to walk
the
around
formal
with
remarks by
a
saying
bottle
that
of hand sanitizer,
I believe we have an
you need to
opportunity as Tennesseans to come together once again, that we can address this challenge that is before us. We have a great responsibility to address it, but it will take every single Tennessean to come together and do their part to mitigate the spread of this disease across our state and to provide for the best outcome possible in the weeks and months ahead. Happy to take your questions.
You said 2 days ago that we didn't need the emergency declaration of clusters. Why is it needed now?
Well, we have had more cases since those 2 days ago, and we believe there are more cases we believe there will clearly be more cases as expanded testing occurs, and the speed with which that is occurring was what caused us to consider making that decision.
Emergency declaration, you're saying we'll open up some funds and you'll be able to access them. But we know that right now the state has $10 million from the federal government. I wonder what do you plan to do with that amount of money that you already have?
Well, I'll let Dr. Long specifically talk about what we believe costs will be going forward, but the emergency declaration also will not only free up the opportunity for us to receive additional funds when necessary, but it relaxes rules around licensure, around prescription regulation, numbers of days around getting a prescription. It will allow us to more effectively treat a surge of cases that come in our state, still protecting the public, but it relaxes rules around that. Dr. Chris, you have comments about our anticipation of what those expenses might be, at least the first ones coming forward.
Specifically, if you can talk about those $10 million from the CDC.
Thank you for the question. We do have several funding mechanisms, but that one that you referenced is the largest. We are in the process of compiling a list of things that, as we scale up, very well may have price tags associated with them. One of the primary things that we want to use the funding for is for telemedicine efforts. And this is not only in an effort to keep patients in their homes and talk to them remotely, but also to offload some of our emergency departments and clinics who not only may be more at risk with sick people in the waiting room, but also just from a volume standpoint. I'll ask Dr. Long to talk a little bit about what hospitals are doing specifically in that realm.
Certainly, hospitals provide a lot of outpatient care as well as inpatient care. And so we're beginning to look at what we can do to keep patients, particularly patients who are elderly or with chronic health conditions, to serve them at home and not require them to be in clinic. So we're looking at things like providing longer prescriptions than we normally would, say for 90 days as opposed to 30 days, providing some of those visits via telemedicine, as Dr. Piercy mentioned, is a high priority. Again, anything that we can do to free up beds and resources. Also looking at issues like canceling elective surgeries in order to free up beds, and really upping our efforts to discharge patients who are ready for discharge. So working with insurers to help patients transition to home with home health care or to other treatment settings if that would free up available beds.
That's all we have, folks. Y'all heard it from Governor Lee and his colleagues. Man, it is crazy, but we all must know what we need to do to protect ourselves. So it is what it is. I encourage everyone to be safe out there. Doing a little surgery, y'all just hold tight, hold tight. Hold tight, hold tight, hold tight.
It's a pronoun for okay, that's a pronoun. Okay, come on, baby, say holiday. It's a holiday. Christmas. Okay. What do you say on come on, Bill. Okay, automobile. Car. If you want your car to go left or right, Got four. You got four. You got three. Bro, you talking about four? You got three. I got. Look, you got wheels. You there? Here.
I'm sorry, y'all. I got to looking at this video, but man, that's the new update, man. Make sure y'all hit that like button. Make sure y'all subscribe. This is your boy, J-Lo, McB. Shalom, man. Y'all be safe out there. Make sure y'all don't catch that shit now. Okay, I'd rather see you live than die. Shalom.